Okay, so this scenario is a big one for your PLAB 2 exam, a real classic. So today, let's break down the cardiology smoking cessation consult, step by step.
Welcome to this clinical walkthrough on the cardiology smoking cessation case for UKMLA, brought to you by Mediate, your 24/7 practice partner. You know, there's a reason this one comes up so often. It's a test of everything, really, your communication, your knowledge, your empathy, the whole shebang. Our goal here is to give you a solid, step-by-step structure so you can walk in there and master it with confidence.
All right, we're going to break this down into 6 key stages, from that first hello all the way to a safe follow-up plan. Think of this structure as your safety net. It makes sure you hit all those crucial marking points without missing a thing. So let's just dive right in.
Okay, section 1, the opening. You know, those first few moments? They're absolutely crucial. This is where you build that trust and figure out what your patient is thinking before you even mention your own agenda. Look at how simple this is. You start with something open, something patient-centered, like, how can I help you today? This is perfect. It immediately tells the patient, hey, you're in the driver's seat, and it lets them share what's on their mind first. That's exactly what the examiners want to see.
So, before you jump into talking about smoking, you've got to check their understanding first. Ask these kinds of open questions to see what they already know about their heart condition, their diagnosis, and the upcoming angioplasty. It just shows you're putting them at the center of the conversation.
Right. But what if they don't bring it up? This is a really common hurdle in this station. The patient's there to talk about their heart, not their smoking habit. So, how do you bridge that gap without sounding pushy?
This right here, this is your perfect bridge. It's brilliant because it's completely non-judgmental. You're just pointing to their medical records, which makes it a clinical observation, not you having a go at them. It's a really professional way to connect your agenda to what's already happening with their health.
Okay, so you've opened the door to the topic. Now we're into section 2, taking that focused history. The key here is to be efficient and systematic, covering both the smoking details and the person's life around the habit. First things first, you need to get the numbers. In this scenario, it's 20 cigarettes a day for 35 years. And look, that's not just a statistic. That number paints a picture. It tells you about the level of clinical risk and just how ingrained this addiction really is.
But, of course, the numbers are only part of it, right? You have to dig deeper. These questions are so important. They help you understand the why behind the smoking. Have they tried to quit? What are they afraid of? What do they actually like about it? This is the gold you'll use later to tailor your advice.
When you're in the exam and the pressure is on, a good mnemonic can be a lifesaver. Famish is a fantastic little tool for a quick psychosocial screen. You know, does the patient have support at home? Are there other things causing stress? It helps you see the whole person, not just a set of symptoms.
Just a quick reminder here, if you want to put all this into practice, you can run through this exact case right now and get objective feedback on mymediate.com.
All right, section 3. Now we switch gears. We've been gathering info, and now it's time to start giving it. And the goal is simple. Explain the risks in a way that's super clear, totally jargon-free, and connects smoking directly to their heart problem.
This is just a brilliant way to lay it out. You break it down step by step. 1. Your chest pain happened because your heart's arteries got narrow. 2. We're going to do this procedure and angioplasty to open them back up. 3. Smoking is the #1 thing that will make them narrow all over again. See? It's a simple, logical story that's impossible to argue with. Okay, section 4, shared decision-making. This is a huge part of what they're testing in PLAB 2. It's not about ordering the patient to quit. It's about working with them, empowering them with choices, making it a partnership.
Honestly, this line is pure gold. It does 2 things so well. First, you say, it's completely your choice, which immediately respects their autonomy. But then you follow up by offering to help them understand their options so they're ready when the time is right. The message is clear. We're in this together.
So then you lay out a menu of real, practical support. Don't just say you should quit. Talk about the NHS Smoking Cessation Clinic. Explain what nicotine replacement therapy actually is. Mention prescription meds. Even bring up things like the NHS Smoke Free app. It shows you have a concrete, actionable plan.
And now for section 5, which, let's be honest, can be the trickiest part of this whole consultation. Patients are going to have concerns, maybe even push back a little. How you handle that with empathy is absolutely key.
Let's just quickly fire through these common ones. If they say, my granddad smoked till he was 90, you say,
I hear ya, but we know for a fact your heart is already affected. You make it personal. If they worry you'll cancel their procedure, you reassure them immediately. Absolutely not. Quitting just protects the amazing work the surgery will do. Worried about weight gain or stress? Acknowledge it's a real concern and then offer a real solution, like a dietitian. See the pattern? It's always validate, then problem solve.
All right, Section 6, closing it out. A good ending is just as important as a good beginning. You need to wrap things up clearly, summarize the plan, and leave a safety net so the relationship is strong, even if they aren't ready to quit today.
A little summary like this is a great way to bring it all together. It's a clear checklist for both of you. Okay, we've given you a leaflet, we've offered a referral, and we've agreed to talk about this again. It's just so organized and professional.
And this is your final, crucial safety net. This sentence removes all the pressure. You don't have to decide today. It leaves the door wide open for the future and really hammers home that you're there to support them, not to judge them. That's what a safe doctor does. So there you have it, the full structure from start to finish. You have all the knowledge. But the big question is, how do you take all this theory and actually turn it into a confident, passing performance on the day?
Well, the answer is always practice, isn't it? And you can practice this exact case now on mymediate.com.